Hello and welcome to today's edition of The Wellness Way. My name is Dr. Raymond D. Today we'll talk about asthma. We'll talk about what asthma is, the causes of asthma, signs and symptoms of asthma, certain complications, diagnosis, and treatment. Asthma is quite a very complicated disorder that belong to a group of obstructive lung diseases. Basically, it's difficulties in breathing that could cause a lot of breathing failures. Asthma can affect all kinds of people from childhood to adults, even though adults may begin to experience asthma for the very first time. Asthma has some familiar history, so that means if there is someone in the family who has asthma, it's possible that you could also have asthma as well. And if you are exposed to cigarette smoking when you were young, you might also have it's a predisposing factor of acquiring asthma. So basically, a patient will present with dyspnea. Dyspnea simply means shortness of breath, and wheezing. So wheezing might be when a patient has difficulties in breathing out carbon dioxide, and dyspnea is when someone has difficulty in taking in oxygen. In all these effects would lead to an individual having difficulties in having a smooth and perfect breathing. Now, asthma is actually caused by inflammation. So you have inflammation that leads to edema in the smooth muscle of our respiratory tract. So if there is inflammation in the airways, is going to, however, constrict or narrow the tubes that air passes through. And once the tube that air passes through becomes narrow, it's going to cause you to have difficulties in breathing. So inflammation is a very key causes of asthma. Now, let me take another minute to explain why inflammation leads to asthma. Now, during inflammation, we know that when you are exposed to allergens, so allergen is also one of the risk factors that could precipitate asthma. So when an allergy is introduced into or exposed into the system, the immune system tries to, in a way, attack it, and by so doing, they would actually release, or the white cells or the immune cells would try to release certain cytokines or immunomodulators like histamine, leukotrienes, and prostaglandins, etc. And these agents are very powerful, that when they are released, they go into the airways and then they constrict the vessels or the smooth muscles of the airways, and therefore causing obstruction, thereby patients experiencing the wheezing, the dyspnea, and the chest tightness, and in some instances coughing. So having known the symptoms of asthma, let's look at the diagnosis. So how are we going to diagnose someone from asthma? There are a lot of diseases that have similar symptoms like asthma, and so you need a concrete or an accurate diagnosis that would differentiate asthma from other obstructive diseases. You could do the FeNO test, you could do spirometry, you could do chest X-ray. You might also be exposed to the meticolin or the meticolin challenge and other various tests to actually confirm that you have asthma or not. Complications. Now, because there is an obstruction in the airways, patients would actually lead to what you call the heart and the breathing failures. and that is when there is severe signs and the symptoms that we experience as the asthmatic attack. In that case, air is entrapped, or air traps within the airwaves, so CO2 cannot go out in the system. That is known as the hypercapnia, and then oxygen too cannot be inhaled inside. So both carbon dioxide and oxygen become trapped into the alveoli, and therefore patients will present with hyper-inflamed lungs, and that is a very serious situation at hand. However, there are certain medications or treatments that could help relieve patients from this attack. However, let's note that asthma has no cure, but there are medications that will relieve people from this attack. So first of all, there are inhalers that client or patient will have to go with in order to prevent getting exposed to these allergic stuff or the allergens. And there are others too that when you are exposed to it and you are starting feeling the symptoms, you will use that one to relieve it. There are also bronchodilators, such as the formoterol, other kind of medications, salbuterol, and all those medications that are there in order to help dilate the lungs or the airwaves so that air can come out and air can get inside. And so in the nutshell, if you are having asthma, you need to actually make sure that you know your allergic stuff, so that you're not going to get exposed to these allergens, and therefore it would help prevent you from getting attacks. If you are also someone who likes smoking, please desist from it, because smoke is also a very powerful agent of precipitating asthmatic attack. Thank you so much for your time, and join us same time next week.